The 4th annual UCSF Digital Health Awards seeks to find the most impactful and disruptive digital health companies. Out of the 1,000 plus submissions, only a select few have become quarter-finalists.
One of the first things she does is review those current medications with Lucy. And she starts with the Levemir, and they have a conversation about what would work for Lucy. They decide to go with the Lantus, and you can see that a PA is required. So in selecting the Lantus, we're going to power an EPA experience that immediately pulls back the question set required to get approval to Lantus. So Dr. Raja can go through, answer the questions, digitally sign, and submit that through in real time. When it can be approved, the answer or the approval will also come back in near real time. And so in this case, we got approval, everything's good to go. And if for some reason there was a denial, it would go off to the care team for further processing. So Lucy's all set to get her now Lantus with that PA covered. She also decided she did want to go downstairs to that health system pharmacy instead of her usual Walgreens. And so Dr. Raj is also going to go in and make that change on her Lisinopril.
Hear in their own words why they should win.
Clinical decision-making has been disconnected from consumer choice. Purchasing decisions are made on behalf of patients without the ability to consider the most affordable or accessible option. That may have been okay when deductibles were low, formularies were simple, and the variability in drug pricing was in the tens of dollars. That's no longer the case. Deductibles are in the thousands. Patients bear the whole cost within those deductibles. Formularies are complex, and drug costs may vary hundreds and sometimes thousands of dollars. At Arrive Health, we're clearing the way for better health. That means enabling consumer choice, affordability, and access within the ordering workflows of providers. That also means empowering patients and their care teams to leverage real-time and patient-specific affordability options. We're approaching a run rate that will result in 100 million transactions a year. We have 150 million health plan members accessible in our network and more than 300,000 providers addressable in our network. We've established ourselves as a leader in point-of-care price transparency, but we're just getting started. Arrive Health is born out of the belief that all people deserve access to affordable and quality care, that no one should have to choose between managing their health and meeting their basic needs. Arrive Health's unwavering focus is to solve patient affordability issues, guide patients down a care path that results in less friction and lower overall costs, and empower providers and their care teams to be a part of that process from the outset. This all starts with the trust that exists between the patient and the provider. Empowering that inherent trust with the right information at the right time is how we are connecting consumer choice and clinical decision-making for the first time.
Join us on November 14th for our grand finale at Health in Las Vegas to see the winners crowned.